Hi everyone, if you are wondering how infertility affects your chances of having a baby, and particularly through natural conception, then this is definitely the video for you to stick around to. Also, if you're a woman who's thinking about delaying motherhood well into their 30s, then this video will be of particular interest to you. Or perhaps you're a woman who is infertile or their partner's infertile. This video will also be of strong value to you as well. Regardless, if you don't fit into a particular category, we present some really interesting data here for the next 10 minutes, so stick around. We are going to answer two questions. The first question is, what is the rate of natural conception that leads to an ongoing pregnancy at 6 months and at 12 months among infertile women who are 35 years of age and over? The second question is that we will be answering, what is the rate of natural conception that leads to a live birth at 6 months and at 12 months among infertile women who are 35 years of age and over? This review was particularly designed to create a guide of treatment strategies to women who were 35 years of age and over presenting to fertility services. I'm going to briefly touch on the background around fertility before we get into the findings. So we know that women fertility actually declines as they get older and their ovarian reserve declines. Although there is some natural variation in this fertility decline, which starts at different ages. So women who live in high income countries, actually we are seeing that they're delaying their start to motherhood for various reasons, such as economic prosperity, wanting to get a higher education, career aspirations, wanting to work for longer before they start being a mother, which is all very understandable reasons. Though what we are seeing is that women who delay their start to having kids, particularly over 30 years of age and older, is that from the time that they do start trying to conceive to the time that they actually do conceive, that this time period is actually getting longer and longer as they get older. And therefore we're seeing a high rate of failing to naturally conceive, and this is where fertility treatments do come in. So really, women are actually facing a dilemma in those who pursue natural conception, and this leads to a decline, an irreversible decline in their ovarian reserve, which actually jeopardizes their fertility outcomes later on when they do decide to have fertility treatments, or is recommended by their doctors to have the fertility treatments. So really, we're going to be here now looking at the evidence around the outcomes after natural conception among these older women, so that you can make an informed decision when you do decide to have fertility treatments. Okay, so now we're going to look into the methods part of this review, and it's just to give you some clarification, background understanding of how these particular articles were chosen and then from which these findings came about. And I understand, this section gets a little bit tedious, perhaps even boring to a lot of you, but I think it's actually quite important to give you some background information of how you could potentially be the judge of the quality of the findings that I present to you, even though I personally break it down for you. So I think it's quite interesting to just listen to bear with me a couple of minutes. So the participants that were observed in all these articles were women who were 35 years of age and older and were attending the fertility services. And I just want to clarify for everyone out there to let you know what is the actual definition of subfertility. And that is classified as a disease characterized by the failure to establish a clinical pregnancy after 12 months of regular unprotected sexual intercourse, or due to an impairment of a person's capacity to reproduce either as an individual or with their partner. So the authors search for all different types of studies, such as, from your cross-sectional case controls to cohorts and clinical trials. The studies that they did particularly exclude were those studies that looked at only fertility outcomes from ART treatment, or women that had any interventions that really permanently affected their reproductive systems, such as tubal surgery. So when the authors went into the different databases, the key words that they searched for were fertility service, waiting list, treatment independent, spontaneous conception across all the different languages. And they focused on those studies that were published from the year 2000 to July 1st, 2018. Okay, so I just want to clarify the outcomes and its definitions. So the ongoing pregnancy was defined as having a baby with a heartbeat after 20 weeks. And if a study had a different definition, then that definition was applied, such as, after 8 weeks or 22 weeks and so on. A live birth was defined as having a delivery of a child, a baby, after 20 weeks. And in those circumstances where there was no data on a live birth, then only the ongoing pregnancy was measured. Now, other outcomes that were also observed throughout the pregnancy was, miscarriage, a loss of a baby in the first 22 weeks, an ectopic pregnancy, the histopathology, and a chemical pregnancy. A few other factors that were also observed that are known to affect natural fertility was the diagnosis and duration of infertility, semen characteristics, cycle menstruation length, the follicle stimulating hormone, antral follicle count, anti-Müllerian hormone, tubal status, and semen status. Also, a little bit more information for my advanced viewers for just the next 30 seconds is that the time to natural conception that led to this ongoing pregnancy or live birth was calculated from the date of the first fertility service they were provided, or if it was a clinical trial, from the date that they were randomized in this trial, all the way to the last date of their menstrual period when they got pregnant. So if there was no date of their last menstrual period, then it was just assumed that their pregnancy was 40 weeks, the full term. Also, the way that the time period between treatment-independent time to natural conception was measured for women was they were either censored or stopped being observed at time of treatment, natural conception, or just simply end of follow-up. Whichever these events occurred first, then they were censored there. On to the most exciting part, the actual results. All right, so overall, we see that 9 studies were included in this review, and 2 of them were clinical trials and the rest were cohort studies. And all these studies were good to high quality. So overall, we see 4,379 women being observed. The median age was 37 years of age, and they were already 2.5 years, median years infertile. All of these studies were from high-income countries, and I really want to point out the significance of that. No matter how good of a quality studies are and generalizable these studies are, it's really important to take into consideration high-income countries studies versus the low to middle income country settings. And this is because different factors are accounted for, regardless of the topic. I just want to give you one really good example, particularly that I read the other day, and that is, for example, outcomes of medications. So, for example, in high-income countries, we know that the medication being administered to the public is very good quality, high quality. We don't question it. It's not something we account for in studies at all. But in Africa, for example, this is a serious concern. So they may be getting administered the correct medication, but the quality of this medication is questionable. And this is something that needs to be taken into consideration in these countries, particularly in Africa, for example. So even if you are observing the same relationship, but just different high-income versus low-income countries, different factors need to be further accounted for depending based on the country's economic setting, socio-cultural setting, and so on. So I just really wanted to point this out because I just think it's really important that everyone knows this and something to consider when you are critiquing and reading other literature out there. Okay, so on to the actual results. Out of all the infertile women, unexplained infertility was seen in about just over half of them, and this was followed by infertility with provided reason. And I'll go into the order of prevalence, the first one being the male being infertile, followed by tubal factors, ovulatory disorders, endometriosis, and lastly, immunological causes. Now, interestingly, what they found was those women that had unexplained infertility were more likely to lead to a natural conception that led to a ongoing pregnancy or a live birth compared to those women who had infertility with reason. And the only exception was those that had infertility because of immunological reasons. So among those women who had unexplained infertility, there was approximately 13% who achieved natural conception that led to an ongoing pregnancy or live birth within 6 months, and this increased to 22% after 12 months. However, though, we do see that these women who are aged 38 years or older, that this probability of natural conception significantly declined. For example, in women who were 35 years of age and had already 2 years of unexplained infertility, it was predicted a 0.15 probability of natural conception after 6 months and a 0.24 probability after 12 months. And now this further significantly declined for women to 42 years of age. I'll give you another example. So for women who were 41 years of age or older and had primary unexplained infertility and who'd been trying to conceive for the past 5 years, we saw that there was a very low probability, less than 5% of naturally conceiving that led to an ongoing pregnancy or live birth within 12 months. So this is a significant decline. So from 35-year-old women with 2 years of unexplained having 24% probability of naturally conceiving after 12 months to when they are 42 years of age, and this is declined to less than 5% after 12 months. So there's a huge difference just within those few years from your late 30s to your early 40s. Now let's look at the limitations of these studies. First of all, these studies had very different study designs and different recruitment strategies across the centres, protocols and countries. These data did not observe any multiple pregnancies and ectopic pregnancies as we had hoped for. Based on this data, we can only make really robust conclusions about unexplained infertility. I think it's also really important to note here that the effects of infertility treatments were not looked at here. Therefore, this review didn't compare between natural conception and infertility treatments. There was also very minimal data on women who were 40 years of age and over. There were about just over 500 women in this age group, and so very little can be made, conclusions can be made in this review. Now let's look at the implications of these findings and also interpret these findings in relation to other studies as well. It is very clear that as women get older, there is a greater likelihood for them having infertility issues. Women who are attending fertility services should continue being encouraged to use natural conception, even if they are waiting for fertility treatment or are undergoing fertility treatment, and they should not give up on their fertility even after treatment does fail. Now, it is very unclear if assisted reproductive treatment adds any meaningful increase in live birth rates on top of natural fertility in particular diagnoses. However, though, it has been globally observed that women who are at least 35 years of age account for 60% of the assisted reproductive treatment usage. Those women who are of advanced maternal age and have very low probability of conceiving naturally or through treatment should actually be considered to have counselling on donor oocyte treatment. Overall, to wrap up what all these findings mean now, natural conception is still an important source of ongoing pregnancy and live births, particularly among those women with unexplained infertility going through clinical counselling or receiving a fertility treatment, and also perhaps for research for future studies to keep in mind. So if you would like to learn more about fertility or perhaps even other topics around pregnancy, please do subscribe to the channel. If you found this video and data very informational for yourself, please do like the video, and if you have any further questions about this article or topic, then please do comment down below. Thank you and see ya.